I've been a cardiac surgeon for over 2 decades. I've opened chests, held beating hearts in my hands. I'm gonna tell you something most doctors will never say. The way we've been treating high blood pressure is backwards. If you're over 60, this conversation could literally save your life. Most people think managing blood pressure means long walks, tasteless food, and swallowing pills every morning. That picture is outdated. There are 3 things you can do in just 10 minutes. Your cardiologists probably never mentioned them. They're backed by clinical research, cost nothing, and work better than standard treatments. Here's what nobody explains. By the time you're staring at a reading of 140, 150, or 160 on that cuff, the damage has already been happening quietly for years. High blood pressure doesn't hurt. It doesn't warn you. It just works silently in the background, pressing against your artery walls every single minute of every single day. Over time, that wears things down. Your heart, your kidneys, your brain. That's why we call it the silent killer. It is not just a phrase. It is literally what happens inside your body. Now, here's what frustrates me as a surgeon. A patient walks in with elevated blood pressure. What happens? They get a prescription, maybe 2, and they're sent home with 3 words. Watch your salt. No one explains what's actually happening inside their arteries. No one shows them what they can do in 10 minutes a day. I am not against medication. Pills help, but pills manage the number. They don't fix the underlying problem. They don't restore flexibility to stiffened arteries. They don't train your nervous system to calm itself. That requires something entirely different. So let me explain what's happening inside your body, because once you understand it, everything clicks. Your artery walls are made of smooth muscle and elastic tissue. When you're young, that tissue is supple. It expands when your heart pumps, then snaps back like a rubber band. But after 60, that elasticity starts to disappear. The walls thicken, they stiffen, and a stiffer artery means higher pressure. Full stop. Regular cardio walking, cycling, swimming is great for your heart, but it doesn't directly target arterial stiffness. So what does? That's exactly where this protocol begins. Step 1 is isometric exercise. And I know what you're thinking, but stay with me. A wall sit, a plank, holding completely still while your muscles work hard underneath. It looks like nothing. And yet a 2023 analysis published in the British Journal of Sports Medicine, covering over 200 studies, found that isometric training produces the largest reductions in blood pressure of any exercise type. Above cardio, above weight training. For people over 60, regular isometric exercise reduced systolic pressure by an average of 10 points. That is the equivalent of adding a second blood pressure medication for many patients. Here is how it works. When you hold a wall, sit, or plank, your muscles contract and stay contracted. That temporarily restricts blood flow. When you release, your vessels flood with blood and expand rapidly. Over time, that repeated cycle actually retrains your artery walls to become more flexible and more responsive. It is physiotherapy for your vascular system. The protocol is 6 minutes total. 2 minutes of wall sit, 2 minutes of plank, 2 more minutes of wall sit. No equipment, no gym. You can do this in your living room right now. If you're just starting out, begin with 30 seconds and build up slowly. And please, do not hold your breath. Breathe normally throughout. If you can't breathe normally, you're working too hard. Step 2 is resonance breathing. And I need you to understand, this is not yoga. This is targeted neuroscience. Your body has 2 modes, fight or flight, which raises your heart rate and constricts your vessels, and rest and digest, which does the exact opposite. Most people over 60 with high blood pressure are stuck with their foot permanently on the accelerator, even while sitting quietly watching television. The vagus nerve is the direct line to the brake pedal, and you can stimulate it deliberately with your breath. Here is how. Inhale through your nose for 5 seconds. Exhale through your mouth. For 5 seconds, that's 1 cycle. 6 cycles per minute. For 2 minutes straight, sitting quietly with your eyes closed. This specific rhythm is called resonance breathing. At exactly this frequency, your vagus nerve fires, your parasympathetic system activates, your vessels dilate, and your heart slows. Studies show that just 8 weeks of daily practice can reduce systolic blood pressure by 8 to 10 points, comparable to medication done in a chair in 2 minutes. Set a timer. Close your eyes. Phone face down. Commit to those 2 minutes fully, because if you rush it, you lose the entire mechanism. Step 3 surprises people the most. You are going to drink water, but not the way you normally drink it. When your body doesn't have enough fluid, your blood becomes thicker and more concentrated. Your vessels narrow to compensate, and narrower vessels mean higher pressure. After 60, your thirst mechanism becomes unreliable. You can be significantly dehydrated and feel nothing at all. But here's the part that changes everything. It's not just how much you drink, it's how you drink it. Gulping water quickly activates your sympathetic nervous system, that accelerator pedal. But slow, deliberate sipping does the exact opposite. It activates your parasympathetic system, the same brake pedal you just engaged with the breathing. So in these final 2 minutes, pour yourself about 16 ounces of water and sip it slowly. One small sip every 10 to 15 seconds. You are locking in the calm your breathing just created and rehydrating your blood at the same time. Think of it as the seal on everything you just did. I am Dr. Joseph, and I've spent 20 years watching what happens when blood pressure goes unmanaged. The strokes, the heart failures, the kidneys shutting down. I've held those consequences in my hands in the operating theater, and I can tell you with absolute certainty, these 10 minutes every morning are worth more than you can currently imagine. Now, I want to ask you something. Which of these 3 steps surprised you the most? The isometrics, the breathing, or the way you drink water? Drop your answer in the comments below. I read every single one, and your response genuinely helps me understand what to cover next. And if someone in your life is dealing with high blood pressure, please share this with them today. It could be the most useful 10 minutes they spend this week. Hit subscribe if you want evidence-based medicine that's actually accessible. No ads, no supplements, no brand deals, just the information your body needs. Take care of yourself, be consistent, and always speak with your own doctor before making changes to your health routine. See you next day.